People say, well, what's a cardiologist talking about silence? It has everything to do with it because it changes your physiology. It changes your whole thinking pattern, changes your thought patterns, your thoughts. It changes them. And there's so many studies to show that we have an influence on our health by our social factors in our life as well. And that's all to do with thoughts. So if your thoughts change, your physiology will change. If your physiology changes, you will accrue all the benefits. If we're on the go all the time, we're having excessive sympathetic overload all the time, and we never get the parasympathetic. Huge problem. Causes reactive oxygen species. You're supposed to be in sympathetic, get reactive oxygen species, and then you're supposed to quench them away with your cholinergic system. The cholinergic system is your parasympathetic. We don't do it. We're constantly in the sympathetic mode all the time, which comes down to that question you asked in the beginning that, what about the vagus nerve? Where does this all kick in? Well, that's the problem. We have a Western lifestyle today that is vagolytic. We just don't have enough vagus nerve function because we're constantly in sympathetic, and we know that. Also, we've knocked off our vagus nerve. So take the leaky gut, for example. In the leaky gut scenario, you're producing reactive oxygen species a lot in the gut because you have that leaky gut. And then all that chemistry is going to produce reactive oxygen species because all those white cells and all lymphocytes are producing reactive oxygen species both in your liver and in your gut lining. And we can measure those. Where's your parasympathetic? It's also dead. Because the enteric nervous system, which is your gut's nervous system, comes from the vagus nerve. So 80% of the signals from your vagus nerve go from your periphery, which is mostly your gut, to the brainstem. And then 20% go outward. Well, the signals are just not coming in. And therefore, the afferent signals, which are the signals going out, which are the cholinergic endings, because they have the acetylcholine at the end, right? So there's receptors on your white cells, on your lymphocytes, on your endothelial cells. And these acetylcholine receptors are supposed to be fed, right, by the acetylcholine. And they are anti-inflammatory. So they drive everything down again. You restore, you come back to normal. It's a homeostasis, the yin and the yang. So this is called the cholinergic system, right? The anti-inflammatory system. And today, I can tell you, there's an epidemic of vagus nerve dysfunction, and it starts for multiple reasons. It's lifestyle. Let's talk about lights. That's a different issue. But there's lifestyle, there's lights, there's circadian disorders, and there again, your gut. You've got to have a good gut, then your vagus nerve is going to work well. If your vagus nerve works well, you're going to get the repair process. The vagus nerve is all about rest, relaxation, restoration, and reproduction. And we're suffering from that today. And when I fix the gut, one of the biggest things that I see is my vagus nerve function gets better. And why am I interested in the vagus nerve? I'm a cardiologist. I'm interested in the vagus nerve from your gut because ultimately, arrhythmias as well. Arrhythmias in your heart are an imbalance of your sympathetic parasympathetic system. So there are many factors that go into the membrane potential that is in your heart cells. One of the things about membrane potential are all the things we talked about, reactive oxygen species, because now look, you're coming on that chemistry again. It changes the membrane. Your membranes in your heart, cell membranes, they're supposed to have a charge, minus 90 millivolts. When you have all this inflammation, it drops down to around 70. So now there's a current between parts of your muscles and another part, and you're going to get these extra recurrent rhythms that are going to occur in your body. And the vagus nerve is another big one that affects the sympathetic parasympathetic system and thereby the membrane potential of your myocytes. Very important. That is why when I fix the gut, arrhythmias get better. Patients who have paroxysmal atrial fibrillation, when they come to me, the first thing I'm going to do is get rid of the inflammation in the body and ask them where the inflammation is coming from and fix it. And I find that the atrial fibrillation frequency goes down because atrial fibrillation is an inflammatory problem. It's a problem due to inflammation and an imbalance of the redox, and that's what's throwing the patient into atrial fibrillation. So I fix the metabolic underlying condition, and the frequency of atrial fibrillation improves. That does not mean that they may not need an ablation, because a few patients need ablation therapy. But my point is that you are not born with ablation deficiency. You are born to have a normal physiology, and the abnormality is created by your abnormal pathology. Fix the pathology, and the electrical system will take care of itself. We are electric beings. Our body is electric. Our membranes are all electric. This potential and electronic changes that are occurring as a result of reactive oxygen species and our inability to have enough reducing agents, our imbalance of sympathetic-parasympathetic system is driving this process. So the vagus nerve is extremely important because it is anti-inflammatory. Our most important anti-inflammatory organ that is now dysfunctional is the vagus nerve.
Well, tying to all this, you mentioned earlier your silence practice. I'd love for you to explain that protocol and how to go through it as a tool for people to help balance out that sympathetic parasympathetic.
I did it for two reasons. One was that patients would say to me that, Doc, I don't have the willpower. How am I going to get the willpower? So part of this is to get willpower. Okay, so I'll explain that part first. The willpower part has to do with the following. If you get a thought and you follow up on that thought, that, oh yeah, I did not pay that bill, blah, 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 and then another thought, now you're stuck in that thought. And you become a slave to that thought. And my point with my patients is that, no, you don't have to take up that thought. You can come back to your nose, feel the breath going in and out, and your ability to pull away your attention from that thought and come back to this is the exercise of willpower. You will develop your willpower because every time a thought comes, you will not follow up on it. So go into silence and know that these thoughts are not something you invited. They just come into your consciousness. And when they come into your consciousness, now you take possession of it. And when you take possession of your thoughts, they'll follow up. And the next thing you know, you're down the rabbit's hole. And that's why people complain to me that I've got this monkey in my head. He's talking all the time. I can't go to sleep all the time. I have all these wretched thoughts all the time. And I said, did you invite them? Did you tell them to come? Did you deliberately say that I want to think this? No, you didn't. They just pop up. They pop up from your subconscious. You do not need to entertain them. And the ability to pull away your attention, your consciousness from that thought and come back to your breathing, and I make them learn how to do that, is the exercise of willpower, because very soon you will notice total silence. When a thought will come, but you're not going to even act on it, and the thought will just fade away. And then you'll be in total silence. Because the silence is not physical, the silence is mental. Now when you have no thought, now comes this part 2. When you have no thoughts whatsoever, you can't be in the past, because that's a thought. You can't be in the future, because that's another thought. So where are you? You're in the current moment. You're in this moment now, in total silence. So what has that got to do with all this? That means that the very source of your stress is going to be gone, because stress comes as a result of past rumination, regrets, or anxiety and stress about the future. But when you don't have a thought, when you don't have an emotion, when you are nothing but a blank slate, what's going to happen to your chemicals in your body? They're not going to react. You see, emotions, thoughts are not in here. Your whole body is thinking it. Every emotion, every thought creates physiology in your body, changes your chemicals in your body. Having angry thought, your platelets are going to get jittery. All of a sudden, they're going to degranulate. Your norepinephrine levels are going to go up. Your nitric oxide level goes down. You get vasoconstriction. Your blood pressure is going to go up. Your heart rate has gone up. Your vagus nerve has gone down. All these things. So thought. So wait a second. Who's thinking? here? Or is your whole body thinking? See, this is important. There's no separation. You feel everything in your whole body. So I'm trying to teach my patients that your thoughts are very important. Don't think that, oh, it's just in my head only and it stays here, over here. No, every thought affects everything in your whole body, your entire physiology. So going into the silence that I'm trying to teach people to do teaches them how to be in the present moment. And when they're in the present moment, not in the past, not in the future, then now you got to deal with something. The doorbell rang. Now you just deal with that and you are there. I use this phrase, you are there with your full bandwidth. You're not thinking of the past. You're not thinking about the future. Whatever activity that you're dealing with, you do it with your full attention. And how were you able to do that? Because you did the silence. Because you did that exercise. You learned how to get into the silent mode. Not in the past, not in the future. You were able to turn off that monkey in your head, stop thinking about the past and the reminiscence of, because all those things generate bad chemistry in your body. Ultimately, what does that do? Changes your redox potential. Ultimately, changes your sympathetic parasympathetic system. Ultimately, when you are in this mode, it's anti-inflammatory. Because that's all I'm interested in. I'm interested in inflammation. Because inflammation is the driver of disease and premature aging. So this is another tool, the silence is. So I teach my patients how to do that. And this is, people say, well, what's a cardiologist talking about silence? It has everything to do with it because it changes your physiology. It changes your whole thinking pattern, changes your thought patterns, your thoughts, it changes them. And there's so many studies to show that we have an influence on our health by our social factors in our life as well. And that's all to do with thoughts. So if your thoughts change, your physiology will change. If your physiology changes, you will accrue all the benefits. So I did teach that, and I think it's very valuable, extremely valuable. And then, so the willpower improves. It's anti-inflammatory. Because in that moment, in your silence, that's it. All your levels come down. Everything comes down. Your heart rate variability increases. It's a function of your vagus nerve. Blood pressure comes down. Pulse rate comes down. Inflammatory markers all go down. Ultimately, that's what I want. You see, you can create this inflammatory substrate through your thoughts and your emotions. You can do it. So it's not just the food that you're putting in your mouth. It's the thoughts that you're entertaining also that can be extremely inflammatory. So it gets so muddy here because here's a guy talking about the mind-body stuff, and he's talking about toxins and environment, the food, and chemistry, and medicines, and supplements as well. And it's true. You have to look at the whole picture. You got to look at the whole thing and how we got there. And when patients come, they don't have one factor that's doing all this. They have multiple factors going on in their life. So I do try to address all of them. That's why my first interview with my patients that I do, it takes me a good hour and a half because I got to know everything, what's going on in their life. And it's not easy.
So is the idea with this silence practice, when somebody learns it, to take a period of time each day and practice it? And then do you find somebody like you that's been doing this, does it transfer into day-to-day life?
Absolutely it does. Absolutely it does. Because then, like I said, I'm coming here with my full bandwidth. Look, we're having this interaction. What matters right now? Jesse and Dr. Jerry. That's it. That's it. I'm not having any thoughts about the past. I have no thoughts about the future. I'm fully engaged. That ability to be fully engaged, my focus, my attention only on this task over here is very important. Because you wouldn't want me to operate on your heart. And I'm thinking about my car that needs to get a new tire put on there, and then tomorrow I got to go to an engagement. You don't want me to be doing, you want me to concentrate on your surgery only. So in our day-to-day life, we need that. So I always tell patients that if someone distracts you or there are other things that really don't matter at that moment, you don't need to deal with it. You just simply tell them, hey, not now, don't use up my bandwidth. Don't use up my bandwidth. Not now. The time comes, I'll deal with it. And then you take one task at a time. And doing that, it makes the patients, and I've seen it, it makes them stronger. They have more willpower. They get more focused. They're going to do it. Whether it's the fasting, whether it's the supplements, whether it's the exercise program that I put them on, whatever it is, or dealing with their dysfunctional relationships, their sleep patterns, their habits, losing their habits, still going through their phones at 10 o'clock at night. They can get rid of all that. Harness the willpower. And you can do it this way. Harnessing willpower through silence. Because silence will give you that. When you come out of it, you also come out with clarity. So when you're in silence, then you get clarity as well. When you're in silence and you come out of the silence, your ideas are different. Because the background upon which those ideas and thoughts are now coming come from a blank slate. They're not adulterated from thoughts that you were just having right now. They're fresh, and you'll notice it. You'll see you can do that. So this is very important. So I brought it up as a thing, and I was really apprehensive about putting it on the video. But I found that already I've had thousands of people saying that they've had so much benefit from doing it.
We got to teach kids this too.
Absolutely. And I think it starts with the kids. It really does these days. It starts with the kids. We got to teach them. That's why I give them silent moments to be on their own and do creative activities on their own instead of constantly stimulating them in company and conversation all the time. I think it's really important. And of course, the eating habits have to start at a very, very young age and very important.